We're back digging into the root challenges of Canada's healthcare model, including what happens when we delay care too long and how underfunding prevention may be costing us more in the long run. So, how is medical tourism playing into this? Is medical tourism a symptom of a struggling system or a legitimate outlet for patient choice? Or can it be both?
Um, I think it's a symptom of a problem, largely a symptom of a problem of a system that is really struggling. Like I said before the break there, Julie, I mean, we've got a healthcare system that spends a lot of money. We've got lots of good people in the system. The structure's not set up right, and it's not delivering the best results possible. So too many patients are falling between the cracks. Many are just downright desperate for healthcare. Behind all these stats and figures are some very troubling stories. Patients that are living with chronic pain.
Well, let's
Uh,
talk about those wait lists then, because they're living long with this. Like, can you explain what is happening with growing wait lists and those consequences? Like you said, people living with chronic pain way too long.
yeah, so we have a system that is not delivering proper results. So the waiting lists are getting longer and longer. People say, "Oh, it's because of COVID," and if you look at the data, you could see growing problems before COVID happened, and then they just kept growing and growing. So COVID contributed to making a bad situation
Sure.
worse, but the problems are not due to COVID.
Right.
It's largely due to a system that is in trouble. We
Well,
have an
and you've
aging population.
yeah, and you've reported on this. So let's talk about that. You have an article where you talk about 332 patients died while waiting for surgery and diagnostic scans, and then you have the wait lists of deaths in Ontario. You know how they demand more solutions, and that there was 74,000 Canadians that have died on healthcare wait lists. Let's talk about that a little bit because that's crazy.
Lots and lots of deaths each year. Nationwide, it's over 15,000 people that died the last time we gathered the data, waiting
Wow.
for a range of healthcare services, everything from hips and knees to heart surgery, which could save someone's life. So very troubling numbers. Those are only part of the story because a lot of government bodies just simply don't have the data. They wouldn't provide it, whatever.
Mm.
It's missing. So the true figure is probably close to double that.
Really?
Yeah, when you look at how
Wow.
many people are dying each year waiting for care.
Yeah.
So that's really bad. The number of people that are on waiting lists, it's huge. It's over 5 million is what we estimate based on asking governments how many people are waiting for surgery to meet with a specialist,
That's
diagnostic
that's
scan.
just crazy. I can't even think of over 5 million people waiting. Like we're
Yeah.
not a huge country.
It's about 1 in 8 people. So, if you got 7 friends together between you and those seven
Yeah,
friends, one of them is on a waiting list for something. It's
exactly.
it's a lot. And
Yeah.
and in some cases it's not bad, right? Like maybe, yeah, I got a bit of a sore shoulder, but I can live my life, whatever.
Hmm.
But in other cases it is bad because these are people dealing with chronic pain. Maybe their cancer's spreading. I mean, there's some
Hmm.
very awful consequences that are happening because our wait times are so long. And this is what people need to understand is that what is going on in this country is not normal, and
Yeah.
it doesn't have to be this way. We can copy what these other countries are doing right to get these wait times down.
What are we doing about preventative care though? Like, is it part of the problem? Do we have enough of it?
I'm glad you touched on that because I think this is a big part of the discussion that a big part of what needs to be discussed that isn't talked about enough. We so often talk about the system and fixing the system.
Hmm.
There's a role for patients in this too, and that
Sure.
is that patients can do things to improve their health so that they're not having to wait for services in the first place. Exercise more, eat healthier,
Hmm.
quit smoking. All those types of
Yeah.
lifestyle decisions that end up contributing to health problems that exacerbate the system's wait times, right? I mean, if you're not eating healthy
Yeah.
and you're not exercising, well, then you can get high blood pressure and heart problems. Some
Hmm.
cancers are due to lifestyle decisions, right?
Right.
So I think we need a much deeper discussion in this country about preventative health care so that people don't have to depend on the system in the
I
first
agree
place.
with you. Well, listen, when we come back, we'll look at how Canada's divided health responsibilities between federal and provincial governments may be holding back real progress. So stay with us. We'll cover this more after the break.